The reason we're starting this new practice is that both of us feel very strongly that for primary care, what we do in our office, you really don't need insurance. And what has happened, insurance has been kind of this beast that's taken over medicine. But for what we do in our office, it's fairly routine. It's not real expensive that you don't need insurance.
The American healthcare system is struggling now because there's a shortage of primary care doctors. Unfortunately, the reason there's a shortage of primary care doctors is because our model of care reimburses primary care doctors based on volume rather than quality. And most physicians do not want to see 30 or 35 or 40 people in a day. They don't feel like they can do a good job doing that.
The trajectory of primary care in America, driven by third-party payers, is that there's just not enough primary care. And to fill in that need, a physician like myself is going to have 1 to 2 nurse practitioners and be more of a quarterback and managing nurse practitioners. I would only see the very sick patients in a day, and that is just not the way I want to practice. I'd much prefer to deal hands-on with fewer people.
The average doctor-patient FaceTime in the United States now is 6 minutes. That's not an adequate period of time to address a real health concern. The average doctor now has about 2,500 patients that would require more than 20 hours of working per day for him to be able to take care of all of those patients. That's not doable. That means if you really need a doctor, the odds are you're not going to be able to see a doctor who you've seen before and who you know and who you trust to take care of you.
I must say that the direction of medicine with electronic medical record and the volume of patients had really been taking away my drive. I totally enjoy the one-on-one with patients in my exam room. It's just all the extraneous details and jumping through hoops that has gotten so burdensome. And this really has excited me and restored my passion in practicing medicine and just what it's meant to be.
We're starting a model of practice in which we'll have substantially fewer patients and more availability so that we can provide care for people when they need it in a way that's affordable to them.
This new practice is not going to take insurance. It's going to be for a set monthly fee, and it's going to be a dramatically different type of practice. Currently, my practice, we have about 4 to 4.5 employees for every doctor in our building, and our overhead is about 75%. Joel and I are going to have 1 nurse for 2 doctors, and our overhead, we're shooting for an overhead of about 30%. And so we're going to pass that cost savings on to our patients.
Direct primary care is a model of primary care in which an individual or a family or a small business pays a certain amount per month or per year for access to a physician. After he or she has paid that amount per month or per year, they can call their doctor, they can have appointments with their doctor, they can email their doctor, they can text their doctor, and reach them in whatever way makes the most sense. Because we're not confined to the rules of insurance, we can address health problems in the way that makes the most sense for the patient, as long as it makes medical sense as well. And so sometimes it warrants a visit to an office. Certain complaints will warrant a visit to an office, but most of the time, a good number of times, we can address things over the phone without someone having to come in, or address it via email without someone having to come in.
Our plan is that we'll be much more able to have longer appointments with our patients. When we can't offer our patients an appointment that day or early the next day, that's when we're going to stop taking new patients. We're going to cap our practice at that number. This has been going on nationally. There's groups in Seattle that have 10, 12 doctors and been going for 10 years. In Fayetteville, John Furlow has been doing this very successfully last year and has been a great help to us to getting our practice started.
I am trying to return primary care to a model that existed in the United States many years ago, but still do it in a way that takes advantage of modern day technologies and modern day advancements in medicine.
The monthly fee is posted on our website, and we're going to be signing people up in December and opening our doors in January.